Well, I'd like to pay tribute to his predecessor, Chris White, who is involved in the Warwick Colleges Group, who's already made representations to me on this matter. We recognise that the college sector plays an important role. This is why we've been increasing the rate. This is why we've been increasing the support and funding, and we'll continue to work with the sector to ensure we do everything we can to ensure it's not just its future stability, but its future success as well.
Thank you, Mr. Speaker. My right honourable friend has done great work making thousands of laptops, tablets and 4G routers available to disadvantaged school pupils. However, colleges like Kirklees College in Dewsbury do not qualify for the scheme and have to use their own funds to support their students. Does my right honourable friend recognise that these are tough times for colleges, and will he assure me that he will continue to look at ways to support them?
Well, this is why we have given extra flexibilities to colleges, as well as making learner support funds available for devices and to cover connectivity costs, which I know is an issue that some students have faced. Further education has to be at the very much at the heart of our recovery from this pandemic. Further education is able to reach into so many communities that in the past have been left behind. This will be a driver not just in terms of creating the life chances and the opportunities for so many young people, but it will also be what drives the productivity across all parts of the United Kingdom. And I look forward to working with my honourable friend, who's such a passionate advocate of not just for colleges in his constituency, but further education of colleges right across the country to ensure we deliver on it.
Harry McCarthy, just in time.
Mr. Speaker, I hope the Secretary of State is aware of this recent report from the Children's Commissioner. It's called Unregulated, and it's about children in care living in unregulated, semi-independent accommodation. I'm bringing forward a 10-minute rule bill next month seeking to regulate the supported housing sector. And can I urge him to speak to his colleagues in MHCLG to see if we can all join together to support vulnerable people who need it?
The honourable lady speaks rightly with a passion and a conviction on this issue, and one that is absolutely shared by myself. We want to see this ended. We want to see this changed. It isn't something that we can allow to continue. As the honourable lady will also be aware, the department has done a consultation on this issue and will be looking forward to bringing forward results of that consultation in the not-too-distant future. It's incredibly important. These are some of the children from the most vulnerable backgrounds anywhere in the country, and we have a duty as a state to do everything we can do to protect them.
Andrew Griffith, final.
Mr. Speaker, the purpose of the Office for Students is that every student has a fulfilling experience of higher education. In light of the difficulties faced by undergraduates at the moment, will he commit to a post-COVID review of the OFS?
Well, I will work very closely with the OFS to make sure that they are working with universities, but making sure universities are delivering what students expect and students require in terms of their studies. We'll always be working very closely with all government organisations to deliver the very best for students and making sure that universities deliver on students' behalf as well.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order. Order! I call the Prime Minister to make a statement. Prime Minister Johnson.
Mr. Speaker, with your permission, I will make a statement on our continuing fight against coronavirus and how we intend to fulfil our simultaneous objectives, saving lives, protecting the NHS, while keeping our children in school and our economy running, protecting jobs and livelihoods. This morning, the Deputy Chief Medical Officer set out the stark reality of the second wave of this virus. The number of cases has quadrupled in the last 3 weeks. There are now more people in hospital with COVID than when we went into lockdown on March the 23rd, and deaths are already rising. And of course, there are those who say that on that logic, we should go back into a full national lockdown of indefinite duration, closing schools and businesses, telling people again to stay at home, as we did in March, once again shattering our lives and our society. I do not believe that would be the right course. We would not only be depriving our children of their education, we would do such damage to our economy as to erode our long-term ability to fund the NHS and other crucial public services. And on the other side of the argument, there are those who think that the patience of the public is now exhausted, that we should abandon the fight against COVID, stand aside, let nature take her course, and call a halt to these repressions of liberty. And of course, I understand those emotions. I understand the frustration of those who've been chafing under the restrictions, the sacrifices they have made. But if we were to follow that course, Mr. Speaker, and let the virus rip, then the bleak mathematics dictate that we would suffer not only an intolerable death toll from COVID, we would put such a huge strain on our NHS with an uncontrolled second spike that our doctors and nurses would be simply unable to devote themselves to other treatments for cancer, for heart disease, and hundreds more that have already been delayed and that would be delayed again with serious long-term damage to the health of the nation. And I'm afraid it is no answer to say that we could let the virus take hold among the young and fit while shielding the elderly and vulnerable, because the virus would then spread with such velocity in the general population that there would be no way of stopping it from spreading among the elderly. And even if the virus is less lethal for the under 60s, there will still be many younger people for whom, alas, it remains lethal. So, Mr. Speaker, we don't want to go back to another national lockdown. We can't let the virus rip. And so we've followed, since June, a balanced approach with the support of many members across the House to keep the R down while keeping schools and the economy going, and controlling the virus by changing our behaviour so as to restrict its spread. That's why we have the rule of 6, and we have restrictions such as a 10 p.m. closing time on our hospitality sector. And Mr. Speaker, I take no pleasure whatsoever in imposing restrictions on these businesses, many of which have gone to great lengths to reopen as safely as possible. Nor do I want to stop people enjoying themselves. But we must act to save lives. And the evidence shows that in changing our behaviour, in restricting transmission between us, our actions are saving lives. Left unchecked, each person with the virus will infect an average of between 2.7 and 3 others. But SAGE assess that the current R nationally is between 1.2 and 1.5. So we're already suppressing that R to well below its natural level, which is why the virus is not spreading as quickly as it did in March. But we need to go further. In recent months, we have worked with local leaders to counter local spikes with targeted restrictions. But this local approach has inevitably produced different sets of rules in different parts of the country that are now complex to understand and to enforce. So Just as we simplified our national rules with the rule of 6, we will now simplify and standardise our local rules by introducing a 3-tiered system of local COVID alert levels in England, set at medium, high, and very high. The medium alert level will cover most of the country, and will consist of the current national measures. This includes the rule of 6 and the closure of hospitality at 10 p.m. The high alert level reflects the interventions in many local areas at the moment. This primarily aims to reduce household-to-household transmission by preventing all mixing between different households or support bubbles indoors. In these areas, the rule of 6 will continue to apply outdoors, where it is harder for the virus to spread, in public spaces as well as private gardens. Most areas which are already subject to local restrictions will automatically move into the high alert level. As a result of rising infection rates, Nottinghamshire, East and West Cheshire, and a small area of High Peak will also move into the high alert level. The very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. In these areas, the government will set a baseline of prohibiting social mixing indoors and in private gardens and, I'm sorry to say, closing pubs and bars. We want to create the maximum possible local consensus behind this more severe local action. So in each area, we will work with local government leaders on the additional measures which should be taken. This could lead to further restrictions on the hospitality, leisure, entertainment, or personal care sectors. But retail, schools, and universities will remain open. As my right honourable friend, the Chancellor, has set out, the government will expand its unprecedented economic support to assist those affected by these decisions, extending our job support scheme to cover 2/3 of the wages of those in any business that is required to close, and providing those businesses with a cash grant of up to £3,000 a month instead of £1,500 every 3 weeks. We will also provide local authorities across England with around £1 billion of new financial support on top of our £3.6 billion Towns Fund. And for very high areas, we will give further financial support for local test and trace and local enforcement, and assistance from the armed forces, not for enforcement, but rather to support local services, if desired, in the local area. Mr. Speaker, I can report that we've been able to reach agreement with leaders in Merseyside. Local authorities in the Liverpool City region will move into the very high alert level from Wednesday. In addition to the baseline I've outlined, this is as well as pubs and bars. In Merseyside, gyms and leisure centres, betting shops, adult gaming centres and casinos will also close. I'd like to put on record my thanks to Steve Rotherham and his colleagues for their cooperation in very difficult circumstances. Engagement with other leaders in the North West, the North East, and Yorkshire and Humber is continuing. I know how difficult this is. They, like us, like everyone in this House, are grappling with very real dilemmas. But we cannot let the NHS fall over when lives are at stake. So let me repeat the offer that we're making to those local authorities. Work with us on these difficult but necessary measures in the areas that are rated very high in return for more support for local test and trace, more funding for local enforcement, the offer of help from the armed services, and the job support scheme as announced by the Chancellor. I believe not to act would be unforgivable, so I hope that rapid progress can be made in the coming days. Regulations for all 3 COVID local alert levels are being laid today. They will be debated and voted on tomorrow before coming into force on Wednesday. We will also keep these measures under constant review, including a 4-week sunset clause for interventions in very high areas. A postcode search on gov.uk, as well as the NHS COVID-19 app, will show which local alert level applies in each area. And we're also publishing updated guidance to explain what the COVID alert levels mean for those who are clinically extremely vulnerable. And while these levels specifically apply to England, we continue to work closely with the devolved administrations to tackle this virus across the whole United Kingdom. Mr. Speaker, this is not how we want to live our lives, but this is the narrow path we have to tread between the social and economic trauma of a full lockdown and the massive human and indeed economic cost of an uncontained epidemic. With local and regional and national government coming together in a shared responsibility and a shared effort to deliver ever better testing and tracing, ever more efficient enforcement of the rules, and with ever improving therapies, with the mountains of PPE and the ventilators that we have stockpiled, with all the lessons we have learned in the last few months, we are becoming better and better at fighting this virus. And though I must warn the House again that the weeks and months ahead will continue to be difficult and will test the mettle of this country, I have no doubt at all that together we will succeed. And I commend this statement to the House.
I call the Leader of the Opposition, Keir Starmer.
Thank you, Mr. Speaker. Can I thank the Prime Minister for advance sight of his statement and for his telephone call earlier today. Mr. Speaker, we are at a critical moment, a tipping point, to quote the Deputy Chief Medical Officer. We have all seen the clear and alarming trend in infection rates. The virus is now spreading in all areas of the United Kingdom, though much faster in some areas than others. And as the Prime Minister said, and the Deputy Chief Medical Officer said, there are now more patients in hospital with COVID today than when the country went into lockdown on the 23rd of March, and deaths are rising. Nobody should be under any illusion about where this is heading or of the need for decisive action. The question today is whether the restrictions announced by the Prime Minister can bring the country back from the brink, whether they can regain control of the virus and provide the support and confidence that local businesses and communities need. That's how high the stakes now are. So we will consider the package. We will look at the small print of the Prime Minister's statement. We will discuss them with local mayors, councillors and leaders in the areas most affected. And we'll scrutinise the economic package that sits alongside them. But I have to say to the Prime Minister, I'm now deeply sceptical that the government has actually got a plan to get control of this virus, to protect jobs or regain public trust. We've tried to give the Prime Minister the benefit of the doubt, but it increasingly feels like the Prime Minister is several steps behind the curve and running to catch up with a virus that he has lost control of long ago. It was less than 3 weeks ago, 22nd of September, that the Prime Minister came to this House to announce new restrictions. He said then that the measures he was introducing then would, I quote, curb the number of daily infections, that those restrictions were carefully judged to achieve the maximum reduction in the R number. That hasn't happened. Those measures have not worked. We wouldn't be here today if they had. And there's a pattern here. On the 1st of July, the Prime Minister told us of his new whack-a-mole strategy to control local outbreaks. 20 areas have now been in restrictions for over 2 months. 19 have seen their infection rates rise, some by very large amounts. So those measures have not worked either. In May, the Prime Minister boasted of a world-beating track and trace system. He told us it would be a real game changer in the fight against the virus. We've debated this many times since, but last week the figures were the worst yet. the Prime Minister promised 100% of test results will be turned around in 24 hours. The latest figure, Mr. Speaker, for in-person testing is just 24% being turned around in that period. This serial failure, combined with the repeated leaks and briefing to the newspapers in the last few days, have fatally eroded public confidence just when we need it most. So can the Prime Minister tell us, what reassurance can he give us that these measures today will be sufficient to get the virus under control? Will he finally accept that trace and isolate should be handed over to local authorities, as we've been saying for months? Will he accept that the support packages announced by the Chancellor simply won't work for many thousands of people, particularly those on the minimum wage? Mr. Speaker, there's huge anger about this in areas under lockdown, and there's a huge gap in the government's plan. And will he confirm that mayors, local leaders, council leaders and others will be fully involved in any future decisions? Finally, I want to say this to the Prime Minister. I know that there will be some on his side who will oppose further restrictions. There will be those that will look at the data and tell him to disregard it, or say the cost of acting now is too high. I want to be clear. The worst thing the Prime Minister can do is not act quickly and decisively enough, or to keep coming back to this House every couple of weeks with a new plan that doesn't work and isn't up to the scale of the task. We need to break that cycle, finally get on top of the virus, rebuild public confidence. I hope the measures announced today will do so. But the House and the country will be deeply sceptical whether they can. Thank you, Mr. Speaker.
Prime Minister.
Well, Mr. Speaker, we've had a slight change of tack, in my view, from the right honourable gentleman who has hitherto been willing to support the measures that this government is putting in place to restrict the spread of coronavirus, and we now see an equivocation. He wants it both ways. He said he supported the rule of 6, Mr. Speaker, and then his side refused to vote for it. He said he's unwilling to support the restrictions we've placed on hospitality. He continually runs down NHS test and trace. What he won't say, Mr. Speaker, is what he would do. And what he won't say is exactly how he would propose to get this virus down without those kinds of restrictions. If he supports the Tier 3 measures that Merseyside City Region have rightly put into place today, then he should say so today. He should have the guts to say so to local leaders across the country, that he supports those measures. He encourages them to go into Tier 3. I think it's a stunning silence that we've heard from the right honourable gentleman. We, by contrast, Mr. Speaker, are working with those local leaders to put in the measures that will protect their populations, protect the NHS, keep our economy moving and drive the virus down. That is our collective endeavour, and I strongly urge him to work out where he stands, to stop flip-flopping from one side to the next, or rather to go back to his previous position, which was support for restrictive measures where necessary to drive the virus down.
Ian Duncan-Smith. Mr. Speaker, can I welcome my right honourable friend's statement and recognise that these are difficult times and my right honourable friend has to make very difficult and, I hope, balanced choices, balancing the economic damage against the need to save our fellow citizens. But in all of this, there is one positive point that's come out, which is rarely referred to, and that is that the death rate at the moment has fallen from 3% in June to 0.6%, which has to be seen as possibly part of what the government is trying to do. And given that, so the strategy of the government is, therefore, to drive down the infection rate, quite legitimately, I understand that, while searching for a vaccine. I just simply want to raise to my honourable friend that others have said, and the scientific advisors have said as well, that there's a lot of talk at the moment about the antivirals, these two antivirals that have now arrived, remdesivir and ivermectin. And given the government's objective, therefore, to drive the infection rate, also underneath that, surely, given the age of death at the moment, averaging 82.4, shouldn't we now make these antivirals much more widely available at the earliest opportunity through GPs and every other doctor to get them to those people to reduce the likelihood, A, of bringing themselves into hospital and then dying? And just talk with everybody. Can we move short, punchy answers and questions? It'll help to get through everybody on this. Prime Minister.
Well, Mr. Speaker, he's of course right that we have better treatments, but alas, the death rate has risen many times over just in the last few weeks, 6 times over just in the last few weeks, and we have no choice under these circumstances, with more people being admitted into hospital every day, to get the virus down.
To Scotland with the leader of the SNP, Ian Blackford. Ian Blackford.
Thank you, Mr. Speaker. Over recent weeks, we've all witnessed the worrying trends of infection, the upsurge in hospitalisations, and sadly the increase in death. The danger of the virus is self-evident. We know that we are at a tipping point. So today must be a turning point. A turning point when we must once again act collectively and get back to the absolute priority of suppressing the virus, protecting the NHS and saving lives. So can I ask the Prime Minister, is the policy to bring the R rate below 1 through the highest level interventions being proposed? Mr. Speaker, since the beginning, we've known that mass testing is vital. Any delays in the processing of tests slow the start of contact tracing. Can the Prime Minister advise what proportion of tests in the last 7 days took longer than 48 hours to process? And what steps are being taken to ensure there is no backlog in processing from the Lighthouse labs? Mr. Speaker, if today is to be a turning point, then the UK government needs to carry out another U-turn on financial support for workers. It is blindingly and blatantly unfair. Just as health restrictions are being strengthened, economic support is being weakened. The Chancellor needs to finally wake up to that logic. No more last-minute half-baked economic announcements. Even Tory-backed in the North of England are calling for furlough to be maintained at 80% of wage support. Will the Prime Minister give some certainty and security to businesses and workers? Will he finally instruct his Chancellor to extend the full furlough scheme beyond October? Businesses and workers must not pay the price for managing the lockdown with closures and unemployment when their businesses would be viable post these special measures. Can the Prime Minister also confirm that devolved administrations will be able to trigger the financial support directly without requiring approval from the UK government when they choose to an area under restrictions to help reduce the spread of the virus? And finally, on universal credit and support for the most vulnerable. Mr. Speaker, last Wednesday at Prime Minister's question, the Prime Minister suggested I ask him again on his government's plan to maintain the lifeline of the uplift in universal credit support. So now that he has had another week to consider it, will he do the right thing and make the £20 universal credit uplift permanent?
Thank you. Well, Mr. Speaker, on NHS test and trace capacity has massively increased, and as he knows, to 312,000. He asked what steps we're taking. We're introducing new testing sites. I think 500 new testing sites. We're introducing more labs for testing, and he asked also about what we can do to get the virus down, and the measures that we're taking, Mr. Speaker. And he's completely right that it depends on enforcement, it depends on testing and tracing, Mr. Speaker, but it also depends on each and every one of us following the guidance, working together to get the virus down, and that is what I hope that he will encourage everyone to do. On the excellent point that he raises about support for businesses that are going to be affected by the latest measures, I would just stress that the Chancellor's latest job support scheme at 67% is highly competitive with all other European countries, indeed more generous than many, and we will continue to put our arms around every worker and every business in this country to the best of the ability of this country. And on his specific point about universal credit, the uplift will remain present for the rest of this financial year, Mr. Speaker.
Just help the House. I'm going to finish this at 5:50, so let's help each other. Jeremy Hunt.
Mr. Speaker, this morning it was announced that the routine testing of asymptomatic NHS staff in hotspot areas would start. This has been long advocated by the Select Committee, and I want to thank the Prime Minister for progress in this area. We all want to avoid a second national lockdown, which would be devastating for jobs. Does my right honourable friend agree that the evidence from China, Korea and Italy is that the best way to avoid this is earlier, decisive, localised interventions, however difficult, however unpalatable, and that today's difficult decision is not, therefore, about a trade-off between jobs and health, but ultimately the best way to secure both?
Well, my right honourable friend is absolutely right in what he says, and I know that local leaders across the country will listen to him, and I hope that they will accept our offer and go into Tier 3 where necessary.
Ed Davey.
The government has asked a lot from people during this pandemic. Stay at home, close your business, don't be there at the death of a loved one. The British people have borne such sacrifice with grace and resilience. All they ask in return from government is clear communication and basic competence. Yet it seems, Mr. Speaker, their sacrifices have been squandered by the government's failure to build a robust test, trace and isolate system or even communicate competently. So can the Prime Minister promise that the new sacrifices he's asking from people today will not be squandered this time?
Well, Mr. Speaker, of course we're working hard with colleagues across the House to get our messages across, and I'm grateful to him for the support he has felt able to give for the measures that we've outlined. I do believe that they can be very effective if they're delivered jointly with local authorities, with local support. And that's what we're working for, and I hope that he will join us in that effort.
Kate Griffiths.
Thank you, Mr. Speaker. I know pubs across Burton and Uttoxeter will appreciate the support available to them through the Jobs Support Scheme in the event of a local lockdown. But will my right honourable friend consider the impact on breweries, for example, which won't be eligible for the support but will have no pubs to be able to sell to?
Well, Mr. Speaker, I understand the point that she makes, and we will have, of course, the regular job support scheme available to businesses that are open but not able to trade in the way that they would want to.
Sir Geoffrey Donaldson.
Thank you, Mr. Speaker. We must, of course, do all we can to ensure that the NHS is able to cope with the current situation. But I agree with the Prime Minister that a localised approach is the right approach, whilst keeping schools and businesses open. But in terms of support for those who have so far not received that support, will the Prime Minister commit to putting his arms around those people who have not yet benefited from the various schemes that have been brought forward by the government?
Well, Mr. Speaker, we always do what we can to improve the welfare system and those who aren't benefiting, but I would just remind the House that the self-employed, which is a group that I think we all care about very much, have received so far £13.5 billion of support, and will continue to look after them as well.
Cliff Davies.
One of the many reasons the Prime Minister has proved himself such a formidable and popular politician over so many years has been his resolute belief in the common sense of the British people. Therefore, instead of a constant blizzard of arbitrary rules which will only serve to collapse the economy and destroy businesses and jobs, will he instead remind people what's important: social distancing, washing hands, the groups who are most at risk, the elderly, people with health conditions, etc., and once again put his trust in the British people to act responsibly? After all, believing that individuals make better decisions for themselves, their families and their communities than the state can make for them is surely at the heart of what it means to be a Conservative.
Well, Mr. Speaker, he is exactly right, and the best decision that individuals can make for themselves, for their families and for communities is to follow the guidance: wash your hands, face, space, protect the NHS and save lives.
People from Conway, with 122 cases per 100,000, are not permitted by Welsh law to make non-essential journeys into Meirionydd next door, where cases stand at 18 per 100,000. But people in Liverpool, with almost 1,600 cases per 100,000, can still go on holiday in Gwynedd and Ynys Môn. People in Wales are asking the Prime Minister, how is this fair?
Well, Mr. Speaker, the guidance is very clear that people from very high areas, such as Merseyside, should not be making those journeys.
Is my right honourable friend aware that in Essex, though the case rate remains relatively low, we have cases doubling every 10 days? And isn't it better to bring in decisive measures which would be effective at suppressing the curve before it climbs, rather than waiting until after it climbs, provided the measures are effective and provided there's economic support, particularly for the hospitality sector?
My right honourable friend is completely right, and that's why we're bringing in the package that we are today.
You, Mr. Speaker. So today we seem to have a partial admission of the failure of the government's outsourced test and trace system, when so many of us have argued for so long that it should be in the hands of public local health teams. Does he regret handing billions over to the private sector who have failed so spectacularly? And will he now give it back to local public health teams who know their communities best so that they can do that in all areas, not just the very high areas? And one final thing, Prime Minister, will he stop saying that he has put his arms around the self-employed, because over 3 million of them have had no support since March?
Well, Mr. Speaker, on her substantive, I repeat the point we made about the self-employed. 13.5 billion have been given to support them, and where there's more that we can do, we will obviously look at it. She makes an interesting point about whether a local approach would have been better throughout this than a national approach. All the evidence is that you need both. And that's what we've supplied, and that's what we will continue to supply. And that's why we're expanding our support for the local approach, because all the experience of other countries shows you need a national approach, because otherwise the local test and trace operations simply do not join up, Mr. Speaker. And there are plenty of other countries where they've had that experience. And that's why we're going down an approach that joins up local test and trace with national test and trace as well.
What does he make of the Special Envoy's statement that we at the World Health Organization do not advocate lockdowns as the primary means of control for this virus?
I totally agree with what David Nabarro had to say. I think he's completely right. And I think that the best way of controlling this virus is commonsensical restrictions on person-to-person contact, that because it's that person-to-person contact that spreads the virus, and that's what we all need to do.
Heading to North Down with Stephen Farry. Stephen Farry.
Thank you, Mr. Speaker. Northern Ireland is suffering from some of the worst COVID figures in the UK. Can the Prime Minister follow through on his commitment to give the Northern Ireland Executive the financial firepower so it can follow the science and do what is necessary to address a deteriorating situation, and to give businesses the support to do what's necessary?
Of course, Mr. Speaker, and the Northern Ireland businesses in Northern Ireland will receive exactly the same support and on the basis of Barnett consequentials. That's inevitable.
Thank you, Mr. Speaker. I welcome the Prime Minister's commitment to work on a local level, and I hope he'll understand my disappointment that Wolverhampton has been lumped into a Tier 2 system, despite the protestations of all 3 MPs and the local council. My fantastic pubs and restaurants have done everything asked of them, and now, because they're in Tier 2, they face no financial support at all and a devastating effect on their viability. Can he urgently look?
Well, Mr. Speaker, I'm grateful to my honourable friend, but actually the job support scheme is precisely available to pubs, restaurants, businesses in her constituency that are not able to trade that may be open but are not able to trade as they normally would.
Merseyside with Sir George Howard. Sir George.
Thank you, Mr. Speaker. The Prime Minister is aware that if we are to tackle these horrendous rises in COVID-19 in the Liverpool City region, we need a much more effective track, trace and isolate system, but we haven't got one yet. Will he accept my suggestion that we establish a Liverpool City region test, trace and isolate task force, including the NHS, local authorities, the Metro Mayor and other stakeholders, to report by the end of this week with suggestions as to how the unused NHS capacity that exists could be used more effectively so that we have a proper test, trace and isolate system in place?
Yes. I'm grateful to the right honourable gentleman. I can tell him that we're already working with the Liverpool City region on improving local test and trace, and I think his suggestion is very apposite, and I'm sure is one that will be taken forward in the course of those conversations.
Mr. Speaker, we're seeing a very unwelcome trend from the party opposite that backs the government's sensible measures one week, only to flip-flop and change their mind the next week. Does my right honourable friend agree with me and several constituents from Derbyshire Dales who have said that what they want to see is this House working together for sensible policies rather than political point scoring?
Yes, indeed, Mr. Speaker, and I think what the people of this country want to see is unanimous support for measures that restrict the spread of the virus, and we've had that. We've had that before. I hope that we'll have it again, and what I hope is that members opposite who are calling on me to do more in Greater Manchester will prevail on the authorities in Greater Manchester to come into to Tier 3 and to help us to get that.
Mr. Speaker, tragically, one of the few certainties about this second wave is that economic hardship will rise. So why will the Prime Minister neither review the level of statutory sick pay, which even the Health Secretary said he couldn't afford to live on, or crucially extend the holiday hunger food voucher programme to cover half-term and Christmas holidays?
Well, Mr. Speaker, as he knows, we've given substantial sums to support meals for kids in need of free school meals in these difficult times, £380 million already, and we will continue through universal credit and other support to support families across this country throughout this crisis.
Thank you, Mr. Speaker. I warmly welcome my right honourable friend's collaborative approach with local government and with the mayors, but will he bear in mind that we have unity among the politicians and the public health experts across the West Midlands under our skillful and much respected Mayor Andy Street in support of the current levels of restrictions, because they do appear to be working. The medical evidence and political consensus suggests leaving the West Midlands at level 1 with the additional local restrictions.
Alas, the virus continues to rise across the country, not uniformly, but the judgments that we have made are ones that we're sticking to.
Thank you, Mr. Speaker. For the record, as you were well aware, Mr. Speaker, Halton is in Cheshire, although it's a member of the Liverpool City Regional Authority, is actually in Cheshire. So can I ask the Prime Minister this? He or his ministers announced new measures, new restrictions on the 14th, the 22nd and the 24th of September, and as recently as the 3rd of October, either national or local, which impacted upon my constituency. Isn't this an example of how the government is shifting from one restriction to the next without any real proper plan to deal with this? So can I ask the Prime Minister one specific question about my constituency? Halton has a low rate of infection than a number of other areas that are not in the highest restriction rate. So can I ask him, why is Halton in the highest restriction rate when others are not?
Mr. Speaker, of course this government is obliged to adapt its plans to combat the virus as the epidemic changes shape and changes course. But our objective remains unchanged, which is to get the R down in his constituency and elsewhere, whilst keeping education open and keeping our economy going. And that's something I think on which both sides of this House are united.
Speaker, the Prime Minister has said there will be a 4-week sunset for areas in the highest restrictions. What reassurance can he give to areas in Tiers 1 and 2, some of which have had additional restrictions already for 2.5 months, that this isn't going to become a permanent state?
Mr. Speaker, we keep all these things under constant review, and nothing could be more attractive to the government than moving the whole country out of the present restrictions that we're in as fast as possible. That requires us all to follow the guidance.
Heading up to Scotland with Drew Hendry. Drew Hendry.
Thank you, Mr. Speaker. The Prime Minister has just said he wants to put his arms around every worker in the country. That'll sound pretty hollow to those people left alone and abandoned, those who've been excluded from any COVID support from his government. They now face a £20 a week reduction in their universal credit. So can you answer the question I'm asked by my increasingly desperate constituents every day. How are they to pay their bills?
Mr. Speaker, don't forget, I'm grateful on the round, but this government has increased universal credit by about £7 billion, perhaps £9 billion, £1,000 a year, and the uplift will remain in place for this financial year, as I told the House earlier on.
By when does my right honourable friend expect to have vaccinated the vulnerable population? What is his confidence in that date? And why does he have that confidence?
I'm grateful to my right honourable friend. Alas, I can't give him a date by which I can promise confidently that we will have a vaccine. There are some very hopeful signs, not least from the Oxford AstraZeneca trials that are being conducted. But as he knows, SARS was discovered, took place 18 years ago. We still don't have a vaccine for SARS. I don't wish to depress him, but we must be realistic about this. There's a good chance of a vaccine, but it cannot be taken for granted.
Don Butler.
Thank you, Mr. Deputy Speaker. Prime Minister, sorry, Mr. Speaker. How dare I? My apologies. Prime Minister, instead of supporting established system in public health, you've invested £10 billion in privatised companies. It hasn't controlled the virus, it hasn't saved lives, and it hasn't rebuilt the economy. In Brent, wonderful CEO Caroline Downs, with the leader of the council, Mo Butt, had control of local testing. We were able to test people very quickly and surrounding areas. Now the government has taken the majority of the testing away. People are told they have to travel miles to get tested. And in addition, care workers have waited 7 days to get their test results. When will the Prime Minister stop his obsession with a centralised approach and go for a decentralised approach that works?
I understand the point that she makes, and obviously, I'm sorry for the bad experiences that some people have had with the excessive turnaround times for NHS test and trace and so on. But I do think that the mixed approach that we're taking is the right one. You need a joined-up national test and trace system combined with the work of local authorities, and that's what we're delivering.
Thank you, Mr. Speaker. I thank the Prime Minister for his statement and for the tireless work he's putting in to tackle this wretched virus. A number of constituents running hospitality businesses have contacted me, like Cheryl, who runs a station in Bishop Auckland, and she's particularly concerned about the lack of households being able to meet within her pub. So can the Prime Minister reassure Cheryl that we will look at lifting those local restrictions as soon as feasibly possible, and we'll also look at taking every step possible to provide additional financial support for those in Tier 2 lockdowns, please? Yes.
Of course, Mr. Speaker, and in addition to providing support for hospitality pubs in Bishop Auckland through the JSS that I've mentioned already, there's the business rate cut that she's familiar with, the grants that I've announced today. But the best thing, as she rightly says, is to get the virus under control so that we can lift these restrictions altogether. That's what we want to do.
Thank you very much indeed, Mr. Speaker. We all know that rising infections will mean more restrictions, but worried staff in viable businesses in Leeds want to know that they will be looked after if they are forced to close in future. Now, I presume the Prime Minister can give the House assurance that the Council will be consulted before that happened. But for someone on the minimum wage who would lose a third of their income in those circumstances, and by the way, the French and German schemes are more generous than those applying here, can the Prime Minister assure my constituents that they will not, under any circumstances, be evicted from their homes because they could not afford to pay the rent?
Prime Minister.
Well, Mr. Speaker, I must respectfully take issue with his characterisation of the scheme, which remains internationally competitive. In France, it's 60% for some, 70% for others. In Germany, it's about the same. In Italy, they have an 80% provision, but a serious cap. In Ireland, it's down, or a very low cap. In Ireland, it's down at 60%. This is a highly competitive scheme, and it's one that I think is generous by international comparisons. And on his point about evictions, of course, nobody wants to see anybody evicted because of the hardship they've suffered because of coronavirus, and that's why we've extended the period in which landlords are prevented from conducting such evictions by a further 6 months.
Well,
Mr. Speaker, families across the country, in whichever of the new tiers, rely on childcare, whether formal or informal. Without it, key workers and those in the wider economy would be unable to work, and many children would be unable to get to and from school. Will my right honourable friend make sure that access to childcare, whether it's professional childcare or relatives and neighbours, remains available throughout this pandemic?
Yes, of course, Mr. Speaker, and I mean, he's totally right about, my honourable friend is totally right about the importance of childcare, and we remain committed to giving 30 hours of free childcare. But the crucial thing about our measures, Mr. Speaker, is to keep the economy moving as much as possible.
Sure.
In university cities like Exeter that have a COVID spike in student accommodation, but not yet significant community spread, but that nevertheless inflates our figures, what is his strategy for containing those spikes in student accommodation and preventing the need for lockdowns affecting the rest of the community?
Well, Mr. Speaker, I think that the differentiation that's often made between students and other members of the public is sometimes overdone. Students, I think, are playing a heroic role in containing the virus where they can, in following the guidance and not spreading it back into their families and their hometowns. I thank them very much for what they're doing, and I hope they continue in that way in Exeter and elsewhere.
Caroline Nelson.
Thank you, Mr. Speaker. I welcome my right honourable friend's decision to reject the twin dire choices of a second national lockdown and letting the virus rip, and I welcome the decision to take up the far more challenging, more complicated path of localising our actions to area. My constituency of Eastbourne is low incidence for the virus, but my hospitality sector is hard hit, and Christmas now is in the frame. So can I ask my right honourable friend what moves there might be going forward to hyper-localise actions and what support there will be for my constituents' jobs and businesses?
My honourable friend is absolutely right that it would be a wonderful thing if we could hyper-localise actions in the way that she suggests. Alas, the disease being what it is, you can't reduce the areas in which we place restrictions too small. But the best thing that her constituents can do, and the best thing the whole country can do, and to get through this as fast as possible, is to follow the package of measures that we've set out. And as I said to the right honourable lady opposite and to members opposite, the best thing would be if cities and regions across the country came together and delivered the package that we set out.
Thank you, Mr. Speaker. Mr. Speaker, last week I asked the Secretary of State for Health whether he would fund local authorities in the North East who put forward a proposal for local test and trace services. The Secretary of State said, in response, we have put an extra £10 million into the local authorities in the North East to support contact tracing. Today I'm told in a telephone briefing that there is no money available. Which is it, Prime Minister? Can we fund the local authorities in the North East to contact that effective test and tracing?
Well, Mr. Speaker, I think she may have missed what I said. We're putting another £1 billion, or up to £1 billion, into supporting it, and I think supporting local authorities, and 500 million for supporting local test and trace and enforcement.
Mr. Speaker, whilst rightly moving to simplify the message, does my right honourable friend agree that flexible local approaches are the best way to tackle outbreaks, to prevent a total lockdown and minimise the wider economic impact, particularly on low incidence level areas such as Broadland?
Prime Minister.
That is exactly right, Mr. Speaker. That's the strategy that we've been pursuing for some time now, and that's why it's necessary to intensify the restrictions in some areas.
Mohammed Jas.
Thank you very much, Mr. Speaker. The Prime Minister keeps telling us that test and trace capacity is being increased. Yet the COVID-19 testing facility at Bedford Borough Hall has just reduced its service provision from 7 to 4 days a week at a time when infection rates are rising. So simple question, Prime Minister, why?
Prime Minister.
Mr. Speaker, I'd be happy to write to him about the test centre that he mentions, but as I told the right honourable gentleman opposite, we are increasing test and trace capacity and tests conducted the whole time, and across. as I said, I'd be very happy to write to him about the particular case he mentions. But it is still the case, Mr. Speaker, that this country continues to test more people and conduct more tests than any other country in